Welcome to another video by my channel. In this video we will discuss glaucoma. Glaucoma is not a single disease process but a group of disorders that are characterized by a progressive optic neuropathy resulting in a characteristic appearance of the optic disc and a specific pattern of irreversible visual field defects that are associated frequently but not invariably with raised intraocular pressure. So, it is not a single disease process but a group of disorders characterized by progressive optic neuropathy resulting in a characteristic appearance of the optic disc and a specific pattern of irreversible visual field defects that are associated frequently but not invariably with raised intraocular pressure or IOP. Thus, intraocular pressure is the most common risk factor but not the only risk factor for development of glaucoma. Most common but not the only. Consequently, the term ocular hypertension is used for cases having constantly raised intraocular pressure. So, ocular hypertension is used for cases having constantly raised intraocular pressure. So, it is ocular hypertension without any associated glaucomatous damage. Conversely, the term normal or low tension glaucoma NTG or LTG is suggested for the typical cupping of the disc and or visual field defects associated with a normal or low intraocular pressure. Classification. The clinico-etiologically glaucoma may be classified as follows: congenital and developmental, that is primary congenital and developmental glaucoma. Primary is without associated anomalies, while developmental is with associated anomalies. B. Primary adult glaucomas, primary open angle glaucomas POAG, and primary angle glaucoma PACG, and there is primary mixed mechanism glaucoma. Then there are secondary adult glaucomas. So this is the classification of glaucomas. The physiological processes concerned with the dynamics of aqueous humor are its production. First it is produced, then it is drained, and then maintenance of the intraocular pressure. Production and drainage system is balanced and maintenance of intraocular pressure occurs. Aqueous humor and its production. What is the volume of aqueous humor? It is a clear watery fluid filling the anterior chamber 0.25 milliliters and posterior chamber 0.06 milliliters of the eyeball. So these are high yield points: 0.25 milliliters in anterior chamber and 0.06 milliliters in the posterior chamber of the eyeball. What are functions of aqueous humor? It maintains a proper intraocular pressure. It plays an important metabolic role by providing substrates and by removing metabolites from the avascular cornea and lens, because these cornea and lens do not have blood supply. So, aqueous humor provides nutrients and removes the waste products from the avascular cornea and lens. It maintains the optical transparency and it takes the place of lymph that is absent within the eyeball. You should know that eyeball doesn't have any lymphatic drainage. Refractive index of aqueous humor is 1.336. So it also plays role in vision. Composition of aqueous humor. It is composed of water 99.9% and solids 0.1%. These solids are proteins. Because of blood aqueous barrier, the protein content of aqueous humor 5 to 16 milligram percent is much less than that of plasma, that is 6 to 7 gram percent. However, in inflammation of uvea iridocyclitis, the blood aqueous barrier is broken and protein content of aqueous is increased. Plasmid aqueous. It is called plasmid aqueous. Amino acid constituent of aqueous humor is about 5 milligrams per kilogram water. Non-colloid constituents are in millimoles. Glucose 6.0, urea 7, ascorbate 8.9 and lactic acid 7.4. Oxygen is also present in aqueous in the dissolved state. Here you can see applied physiology of aqueous humor. Here it is present in the anterior chamber. Here you can see this is the anterior chamber, and here it is present in the posterior chamber. Here you can see in the posterior chamber. How it is produced, how it is drained, it is the discussion of next slides. So we will see here how it is produced and drained. It should be noted that composition of aqueous is like plasma except that it has high concentrations of ascorbate, pyruvate and lactate, high yield points, and low concentration of protein, urea and glucose. Aqueous humor. Anterior chamber versus posterior chamber. The composition of aqueous humor in anterior chamber differs from that of aqueous humor in the posterior chamber because of metabolic interchange. The main differences are bicarbonate in posterior chamber aqueous is higher than in the anterior chamber. Chloride concentration in the posterior chamber is lower than in the anterior chamber. Ascorbate concentration of posterior aqueous is slightly higher than of the anterior aqueous. So these are the differences between the aqueous of anterior and posterior chambers. Production. How it is produced? It is derived from plasma within the capillary network of ciliary processes. It is derived from the plasma within the capillary network of ciliary processes from here. The normal aqueous production rate is 2 to 3 gram liters per minute. The three mechanisms, diffusion, ultrafiltration and secretion, active transport, play a part in its production at different levels. The steps involved in the process of production are summarized below. 1. Ultrafiltration. Most of the plasma substances pass out from the capillary wall, loose connective tissue and pigment epithelium of the ciliary processes. Thus, the plasma filtrate accumulates behind the non-pigment epithelium of ciliary processes. Second step is secretion. The tight junctions between the cells of the non-pigment epithelium create part of blood aqueous barrier. Certain substances are actively transported or secreted across this barrier, into the posterior chamber. The active transport is brought about by the sodium potassium activated ATPase pump and carbonic anhydrase enzyme system. Substances that are actively transported include sodium chloride, potassium, ascorbic acid, amino acids and bicarbonates. So, sodium chloride, potassium, ascorbic acid, amino acids and bicarbonates are transported actively. Third step is diffusion. Active transport of these substances across the non-pigment ciliary epithelium results in an osmotic gradient. This osmotic gradient is when produced, then the movement of other plasma constituents into the posterior chamber by ultrafiltration and diffusion occur. Sodium is primarily responsible for the movement of water into the posterior chamber. Sodium is responsible for the movement of water into the posterior chamber. So this is the part 1 for understanding glaucoma. In the next video, we will finish the discussion on glaucoma.